Hello, I'm Dr. David Harari. I'm the president and co-founder of Reproductive Sciences Medical Center. I want to take the opportunity today to talk to you about some exciting new technology that's available for women to empower themselves to preserve their own fertility potential. Whether women busy with school or finding themselves not in a social position to have the right partner to start a family with, whether they have economic concerns and have to devote most of their time to their job, or perhaps they're pursuing furthering their education, many women have a reason to delay childbearing. What egg freezing does is it provides the technology to empower women to take control of their own reproductive health. And why is that important? Well, it's important because a woman's eggs begin to lose their fertility potential after age 35. And so, by recognizing this fact and acting upon it, women now have the ability to harvest their own eggs or freeze their own eggs and keep those eggs' fertility potential intact for a later date when those women decide that they want to create a family. This process is called egg freezing, and we're going to talk to you today about some of the details surrounding egg freezing.
Egg freezing is a wonderful new technology that we have that allows us to collect the eggs now, freeze them for storage, and use them later to create a pregnancy at a time that is both convenient and appropriate. Hello, I'm Dr. Friedge.
Hi, nice to meet you. My name is Sarah.
Okay, well, welcome.
Thank you.
So you're interested in egg freezing, is that what I hear?
Yeah, right now I'm 28 years old. I'm a graduate from law school and I'm really looking to fast track my career. So creating a family is not really on my mind right now, and I heard a little bit about egg freezing, and I'm looking to learn a little bit more about it to see if it's something that I'd be interested in pursuing.
Well, I think that's wonderful that you're looking into all your options at this point, because this is the optimal time to freeze your eggs. As women age, fertility rates go down, most especially after 35. So you being 28, you're an ideal candidate to bank your eggs for the future. Note that as women age, fertility success rates go down. So the best time to collect your eggs is in the 20s and early 30s.
One of the myths that I hear very often is, that this egg freezing process is going to take too much time out of my busy schedule. But in fact, there's very little preparation that needs to be done in the months prior to an egg freezing cycle. And in fact, the stimulation cycle only takes 10 to 14 days.
Many patients ask me about the advantage of egg freezing. The stimulation takes only 10 to 14 days before you're ready for the egg retrieval. As a matter of fact, the egg retrieval itself, it takes only 20 minutes on average. You would be put under anesthesia for comfort. And after that, you would be discharged home quickly. The recovery after that, virtually painless. It takes only 24 hours.
Tell me how you do it.
Well, the ovaries contain follicles, and in those follicles are eggs. And each month you drop one egg, and that's what allows a woman to get pregnant once a month. What we do is we give fertility medications that get many follicles to grow. And then we follow the people with ultrasounds and blood work, and we know when they are mature and ready to be collected. At that point, we have a very painless surgery, all under anesthesia, you won't feel a thing, and we collect the eggs.
So we've been discussing egg freezing and preserving fertility, and now you've made your decision that you want to freeze your eggs. So what really is important in helping you determine where you're going to go to have this process take place? Well, obviously, the physicians that do the stimulation cycles need to have a lot of experience. They need to take great care in selecting the right medications needed for the stimulation cycle. Additionally, it's important for the IVF center to have an excellent laboratory associated with it, like we have here at Reproductive Sciences Medical Center. Our laboratory is a state-of-the-art laboratory using all the best rapid freezing techniques for the harvested eggs that we receive and the storage of those eggs indefinitely to allow you to have access to them for many years to come.
A long time ago, we whole society used the slow freezing. Slow freezing includes the changing of the phase, which means there are a lot of the water in the cell, and then during the processing of the slow freezing, the water changes to ice, and then during the changing the phase, the water also creates some ice crystal, which is very sharp and also can cause cellular damage. This is why we only achieve the limited success. However, unlike a slow freezing, vitrification does not include the freezing process. We use a very highly concentrated solution for vitrification, and then there is no ice crystal. This is why we have achieved much better outcomes with rapid freezing vitrification.
Some of the concerns have been the degradation of the egg over time. And by the freezing process, we're able to preserve that egg's ability to fertilize.
When patients thought about planning about the egg freezing, they are curious about how long time they can freeze the eggs without any issues. There are some scientific already results and then evidence that sperm can be frozen more than 20 years without any deterioration or problem. Because after storing more than 20 years, the sperm thawed and then successfully they conceived the babies. What about the embryos? Embryos more than 24 years of stored embryos in super cold temperature, which means minus 196 Celsius. Then after storing more than 24 hours, the embryo implant and then became baby. What about oocyte? Oocyte freezing is a recent technology or the trend. So there is about the results that about 14 years of a storage period, and then they thaw the oocyte and then successfully create the babies. So I can say there may be, if we store really super long period, like 20 years, 30 years, or maybe 50 years, however, at least we can guarantee that within 10 years of period, sperm and an embryo and an oocyte will be no issues. As the lab director, what I can guarantee is we are providing the best service in the world.
Although egg freezing is becoming very popular, it's important that when you select your program, you go to a program that has all these levels of expertise available, a good communication between departments, and overall management to allow the optimal results to be obtained, and for you as a patient to preserve your fertility potential for the future and empower you in the ability to create a family on your own terms when you want to have them. Thank you.